Good morning, everybody. Welcome to another meeting of the Montgomery County House Delegation. Obviously, everybody on this call knows we have a hard stop at 9:30 because we have caucus meetings before our floor session. And so we're going to jump right in, and we'll just sort of maximize once the health folks show up at 9 as best we can, getting through as much as we can during our limited amount of time. I see Chair Zucker's joined. I don't know if you want to add anything at the top here.
No, I'm good. I was here earlier. I didn't want to interfere with your business, but appreciate you allowing the Senate to join you this morning for its important discussion. Yep.
And again, sorry that it'll be cut a little short, but we're doing our best with the floor schedule. So with that, let's go to our business. Also, let me say I felt very bad about saying this meeting for 8:45 until Chair Smith from Baltimore City got up and said her meeting for 8 a.m. So I sent you all text saying sorry, but actually, I should be saying you're welcome. But seriously, let's get on with our agenda. Chair Shetty.
Thank you, Mr. Chair. This morning, we'll be considering MC 2221, Montgomery County Voting Methods, presented by Delegate Acevedo. This bill had a hearing before the Montgomery County Delegation last week. As you all know, this bill authorizes the Montgomery County Council to adopt a ranked choice voting system or an approval voting system for the election of a number of different offices at the county level. The bill also allows for the implementation of a local law to regulate the ballot format, procedure for tabulating votes, and any other necessary provisions. The Education, Elections, and Housing Committee met this week. We adopted 2 amendments and passed the bill favorable with amendment 6-0. The amendments essentially just functionally bring this bill back to the same posture that passed unanimously out of the Montgomery County Delegation in 2019. So amendment number 1 makes technical changes to the purpose paragraph. Amendment number 2 alters the list of offices that might be elected by ranked choice voting or approval voting to be inclusive. We also ensured that there was language in there, ensuring that there would be an educational campaign for voters as well. Thank you, Mr. Chair. May I get a motion to adopt the amendments? Or do I offer that?
Move favorable.
Second.
Delegate Wilkins moves the amendments. Delegate Barbet seconds. Was there any discussion on the amendments? The amendments? Okay, I think all in favor of the amendment signify by saying aye.
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 Anyone wish to be recorded in opposition or to abstain? Okay, the amendments are adopted. Madam Chair.
May I please get a motion on the bill as amended?
Move favorable.
Second.
Second.
Sure. Delegate Barbet moves the bill. Delegate Moon seconds. Is there discussion on the bill? Okay, why don't we do this as a recorded vote, Jen, if you're ready?
All right, sorry. Alt-A is supposed to do audio and it is not doing audio. Excuse me. Delegate Acevedo.
Yes.
Delegate Barbet.
Yes.
Delegate Carr.
Yes.
Delegate Charkoudian.
Yes.
Do we have Delegate Crutchfield or no? Delegate Cullison? Delegate Dumais?
She's nodding in the affirmative.
Sorry. Delegate Fraser. I can't see who's on. Delegate Fraser Hidalgo?
Yes.
Okay. Delegate Gilchrist?
Yes.
Delegate Kaiser?
Yes.
Delegate Kelly?
Yes.
Delegate Lopez? Delegate Love?
Yes, and a big hello to AJ. Okay.
Delegate Lutke?
Yes.
Okay, sorry, Delegate. Delegate Moon?
Yes.
Delegate Polakovich Carr?
Yes.
Delegate Chi?
Yes.
Delegate Queen?
Yes.
Delegate Resnick?
Yes.
Delegate Shetty?
Yes.
Delegate Solomon?
Yes.
Delegate Stewart?
Yes.
Delegate Wilkins?
Yes.
Mr. Chair?
Yes.
All right.
Great, the bill passes. Thank you, Chair Shetty. Congratulations, Delegate Acevedo. We have one other piece of business to try to get through while we wait for the health department folks. I'll let Vice Chair Carr explain, but he has an amendment to another county's bill to include Montgomery County, and this would require a vote of the delegation, because if it affects Montgomery County, they're going to ask our opinion on it, as is the norm for our standing committee. So let me turn it over to Vice Chair Carr to explain what he's seeking our support on.
Thank you, Mr. Chair. So yeah, good morning, colleagues. So on September 10th, we had an Ellicott City event, a severe rainstorm that affected my district, maybe your district too. It affected parts of Montgomery, both Montgomery and Prince George's counties, and revealed the inadequacy of the infrastructure. So Delegate Ivy in Prince George's County, he has proposed and successfully passed a very simple bill. It just requires a study by the state agencies, Maryland Emergency Management Agency, the Department of Transportation, and the Department of Environment, to study flooding and analyze a historic flooding, evaluate the prevention and control measures, environmental issues, and recommendations. So the bill, which has passed the Prince George's County delegation and will be going to the Environment and Transportation Committee. This is an amendment to that bill, which simply adds a parallel study for Montgomery County, which was affected by the very same storm. So I would ask for your support. I assume that the Environment and Transportation Committee would not consider this unless and until the Prince George's County delegation also would vote to allow such an amendment to go forward. Thank you.
Delegate Barbe.
Move support.
Thank you. Just, I'm going to abstain on this, not because I oppose it, but the leadership group of the House of Delegates really wants to limit study commissions and work groups and task forces in the law. So we always take these things up at the very last moment in our committee, and we pass at most one or two of them. So I just, for that reason, I'm going to abstain, but it's not to be interpreted as my opposition to the concept.
Any other questions or discussion? Okay, I think Delegate Moon moved support. Is there a second?
Second.
Second.
Delegate Acevero seconds. Any further discussion? Any questions? Okay, let's try to do this by voice vote, recognizing that Chair Barbe wants to abstain, even though I'm not I'm not totally sure it's a conflict, but we'll defer to the former chair of the Montgomery County delegation to interpret the rule. All in favor signify by saying aye.
Aye.
Does anyone want to record an opposition? Okay, and of course you have Delegate Barbe's position.
I'm abstaining, but not because it's conflict of interest.
Yeah.
You can
Great.
abstain for a non-conflict in the.
As I said, I'll defer to the former county delegation chair to interpret the rule. All right, I think we're still waiting for our friends from the health department. So if, I'll defer to folks how they want to handle it. You might just want to turn your cameras off while we wait, and then we can sort of restore to life when they get back on. So keep an ear out, but feel free to get some other work done. Okay, welcome back, everybody. We have at least one of our Department of Health speakers, so I'd like us to go ahead and get started given how little time we have. Dr. Chan, good morning.
Good morning.
Thank you for joining us. Just so you're aware, we have a 9:30 hard stop because of caucus meetings before the House convenes this morning, but we appreciate you joining us. Obviously, there's a lot of concern with the vaccine rollout, and we sent a letter drafted by all 32 members of the Montgomery County House and Senate delegation earlier this week. I recognize you're all getting a lot of correspondence on this topic. I think the members have concerns that are broad-based, like the challenge of asking 90-year-olds to navigate multiple sign-up systems and wait lists, as well as things that are Montgomery County specific. For example, the need for a mass vaccination site in the state's largest jurisdiction, and one by the governor's own telling is not doing as good a job as it needs to do. So I think there are a number of questions and topics. Of course, we want to give you a chance to make some opening remarks if you'd like. And I think we're also going to be joined by folks from our county health department as well that, like you, they're juggling a lot of meetings. But we appreciate you being here. I'll also say, I think we all appreciate Webster and his team and, his response to individual questions, but we appreciate you having this conversation with us as a delegation as we all try to serve our shared constituents. So Dr. Chan, good morning, and the floor is yours for a few minutes.
Great. Thank you so much. And thank you to the Montgomery County delegation for having us this morning. I should also be joined by my colleague, Heather Scheck, and possibly Dr. Mark Martin from our Office of Minority Health and Health Disparities. He'll be here this morning as well to help answer questions. So, I would say that, when we have been working, with local health since the early part of the pandemic on all of our response efforts, and they continue to be an important aspect and colleague and partner in our work. We, over the last couple of weeks, have really hit some milestones in terms of opening up some mass vaccination clinics, and including at Six Flags, which was one of our first mass vaccination clinics because we are using the existing infrastructure that was actually set up back in June for testing, and so we have pivoted using that existing infrastructure to now do vaccinations. And, we continue to push out additional appointments, and I think that we're opening those up for additional appointments as we get more vaccines. We continue to also focus on allocations in an equitable fashion, recognizing that there are disparities that have shown up in data throughout the pandemic that are reflective of underserved communities. And so much of our effort now is really trying to hone in on those underserved and vulnerable populations, working with Dr. Martin, working with Brigadier General Burkhead with the Equity Task Force, and deploying vaccines and also strategies to reach those populations, again, in partnership with local health, in partnership with hospitals and other providers throughout the state. We've come a long way since we first started in December. So our very first shipments came the week of December 14th, and there was a ramp up effort over the holidays into the early part of January. And so we continue to build multiple layers of vaccine access points, given the information that we're getting from our federal partners that additional vaccine is coming. And so we definitely want to have access points for individuals across the state. And so mass vaccination sites are one component of it, community-based sites that are larger, including many that are being stood up by local health departments, pharmacies and hospitals, and federally qualified health centers, and then smaller community-based, maybe more mobile vaccination sites as well. So we know that it's going to take multiple types of providers and multiple types of access points for individuals to be vaccinated. We are mounting an effort as well to get to some of our most vulnerable seniors in independent living and who may not be able to go out to one of the sites. We've done that with CVS and Walgreens using the federal pharmacy program, who have reached all of the nursing homes and are going back now for the second dose clinics and are in the middle now of vaccinating individuals in assisted livings and group homes. So there's a lot of effort that continues to happen, and our greatest limitation is total number of vaccines. And so as we get more vaccines here in the state, we are committed to pushing those out to Marylanders. So I will stop there and see if Heather Scheck, who's my colleague, is on the line, and if she has anything to share quickly, because I do know that you have a hard stop.
Yeah, thank you, Dr. Chan. Good morning. As Dr. Chan said, I'm Heather Scheck. I'm the Deputy Director of Governmental Affairs at the Health Department. And I know we have a short amount of time, but I did just want to highlight a couple slides, and I'm going to try and share my screen that just show what Montgomery County has gotten from the state previously. And I just think it's a really good description of the work that we're doing and in collaboration with the county. And so what I'm going to show you is information that we've pulled from Immunet from the start of vaccination, COVID vaccination through February 8th. So for the first 9 weeks, the state has allocated just over 721,000 doses, and the Montgomery County pro rata share is 125,000. And what I really want to point out is that the state average for doses per 1,000 is 11.9. And you can see here that Montgomery's doses per 1,000 is 12.3. And so I just wanted to highlight that Montgomery County is hovering right around the state average. And then the next slide that I will show you, if I can get it to move, is the allocation sources. And so you can see that a vast majority of the allocations have gone to the health department. And then close behind are the long-term care programs. And I won't go through all of the different facilities. And I will send these to the group after the presentation. I just realized that I didn't send them out ahead of time, so I apologize. And the all others that you're seeing, that's about 20%, is because we've spread it so wide, and we have so many different providers getting small number of sources, so that we could open up all of those registration and appointment avenues. And then the next slide you'll see is it's showing that for the providers in Montgomery County, the percentage of their doses that are actually going to Montgomery County residents. And so you can see that Kaiser Gaithersburg, the Montgomery Health Department, really, the top, I would say more than 50% of the providers in Montgomery County that are getting doses are vaccinating Montgomery County residents. And I think that speaks to what a good job the county has been doing for outreach for their own folks. And I did want to point out, just because Dr. Chan mentioned it, that you can see at the Six Flags mass vaccination site, about 25% of the vaccinations completed there are Montgomery County residents. And so I just thought that was an interesting data point. And then the last slide is just another depiction of what I just showed you, except instead of percentages, you can actually see the exact number of doses administered to Montgomery County residents by facility. And so I just wanted to put that out there to try and give a little bit of a better 30,000-foot view about what Montgomery County is getting from the health department, the state health department. And I will stop there so that we can take questions.
I don't know if Dr. Martin also had opening comments, Dr. Chan.
Yeah, I just want to say good morning to everyone, and thank you for this opportunity to follow up. We are working really hard to get into the grassroots levels of the community, and but I'll stop right there because I know that your time is limited. So I'll just hold right there.
Great. And I think we have Dr. Gales as well. Dr. Gales, I know you see us quite a bit, so I'm not sure if you want to add anything at the top here. Okay, silence. We'll assume no. We'll start going to questions. Delegate Kelly.
Oh, thank you, Delegate Corman. I'm sorry for the background noise. I have a question. I was going to direct it to Heather, but if Dr. Gales is there, I would appreciate his answer as well. I know Dr. Gales received these questions from me over email yesterday in advance of this hearing. I'm very concerned, and I know many of our colleagues are, about what on Monday was 17,200 or something people on our pre-registration wait list who are over 85 years old. I know that the elderly population has a much, much higher risk of death and hospitalization than the others. And I am very concerned that the current system we have is not prioritizing the elderly within the 75 plus age group. So those who are 85 or 90 or older. Again, according to Montgomery County's lists, it was more than 17,000. I really appreciate the work that's been done in terms of independent living communities and building a list of those. But in Montgomery County, many of our seniors live in what we would call a NORC, right? It's a dense senior housing that is not officially on the senior housing lists. And so these folks are not being prioritized by either the state or the county system right now. And so I guess my question is both to Heather and to Dr. Gales, what are we going to do in the next 2 weeks to make sure everyone over 85 in Montgomery County is vaccinated? And particularly, can we give these folks a timeline in terms of when they're going to get an invitation for a vaccine?
Dr. Chan, I don't know if someone from your team wants to, we might have lost Dr. Gales. I know he's juggling multiple meetings.
Great. No, thank you for that question, Delegate Kelly. And I wasn't sure if Dr. Gales was going to respond. So, one of the efforts that we've been doing, working very closely with Secretary Kramer at the Department of Aging, is identifying elderly individuals who are living in congregate settings that might not be on the long-term care program with CVS and Walgreens. And so we have identified a number of those facilities around the state, including.
Let me just stop you for a second, Dr. Chan, because I know that. My concern is the county list has 63 facilities on it. Of those, there's 34 left that don't have vaccination appointments, but we know there's a process for them. My concern is for the tens of thousands of people across the state, and probably about at least 10,000, I would guess, in Montgomery County, who are elderly, who do not live in those identified facilities, but rather live in a naturally occurring retirement community. In my district, we have Friendship Heights, which is denser than Manhattan. It has 1,600 seniors. More than 400 of them are over 85 years old, and they haven't been identified by the state or the county as a priority yet. And to my understanding, based on the state guidance, the county is not prioritizing people over 85 in front of people over 75, even though their risk of death is so much greater.
So happy to try to identify those communities. If we don't have them on our list, we are adding them as we have information about them, because as you said, they are not necessarily regulated, and we may not have awareness of them. And so our prioritization is for all individuals over 75. And so if there's a list that Montgomery County has, we are happy to work with them to on that list.
So if it's sitting with the county now in terms of identifying these dense senior housing communities that are not officially senior housing, from what I understand from my conversation with Secretary Kramer, the state is ready to approve those, but the county has to add them to their official list right now. Is that the process as you understand it as well?
Again, if there are communities, specific ones that have senior housing or elderly who are living them, we are happy to work with the counties to identify them and work with them to target them. Again, it's not only the local health departments, but also coordinating with some of our hospital partners as well as our pharmacy partners to be able to get out and vaccinate them as we have.
And I want to commend the state for prioritizing that. Leisure World and Riderwood have both been vaccinated as a result of partnerships with hospitals that the state has initiated. My concern is that the folks who are not in those kinds of facilities are not being prioritized by the county. And we need a little help from the state to make sure that that happens. Thank you so much. Really appreciate the work you're doing.
Okay, just so everyone knows, there's a lot of questions. So Delegate Fraser Hidalgo?
Yep, I guess this is Ms. Scheck. You had a graphic up earlier, and you were talking about the number of doses that have been issued out in Montgomery County being slightly higher than other parts of the state. I'm not sure if I read it right. It went through pretty quickly. But how are we prioritized as a county based on population density? I don't know if that's in there. I saw we were slightly higher, but again, what does that mean as far as our density and population here in MoCo?
Sure. So when when our team, the planning team, initially looked at doing the allocations, they looked at it by 1,000 doses per, doses per 1,000 people. And so we looked at the population, the census of Montgomery County, and tried to do our allocation so that the state average, I think I said, was around 11.9. And I do apologize because I did go through them quickly, and I'll send those out afterwards. And so we tried to, as we allocated our doses, get each county's population into account and get that number as close to possible as the state average.
Delegate Fraser Hidalgo, are you good? Okay. I should have noted up top that we have members of the Senate delegation as well for the Department of Health's benefit with us. Delegate Resnick.
Thank you, Mr. Chairman. I wanted to point out there was a graphic put up, I believe it was the second slide, that shows that where the doses in Montgomery County are going. I believe, Ms. Scheck, you made the comment that the state county department is getting the vast majority of the doses, I believe was the word that you used. That graphic showed about 25% going to the county. So that was, I don't know if that graphic is inaccurate or not, but I just want to point that out. But my question is, this issue of signing up for constituents has become a problem. And I appreciate the state and the county trying to work together to try and get vulnerable communities and vulnerable constituents immunized. But what we are seeing is a lot of confusion. And I believe Delegate Kelly posted yesterday that thousands of people showed up to Richard Montgomery High School because there was a rumor that there was an open call for immunization, and thousands of people showed up, getting in line, waited for hours. People who actually had appointments were delayed because of this. The confusion stems directly from the fact that we do not have a single form of sign up. And I believe that some of you may have seen my op-ed yesterday where I was none too polite to the governor and the acting secretary, because we are seeing this confusion. My wife is sitting on the couch for hours at a time, booking appointments, trying to get appointments for random constituents of mine. She doesn't have to do this. Thankfully, she has the time and willing to. But we have people going out to Denton and to Garrett County who are able and willing. Why can we not simply have a single sign-up stream where people can go in, get slotted for an appointment at a particular location, even if that appointment is 2-3 weeks out? But if they could just go to one place, sign up, and then you all, through all the coordination you're doing with the counties and the private partners and everything else, control this list and slot people in as appropriate. That will eliminate the confusion. It will give people a date certain, and it will help clarify this process. Why can't we do this? I don't know from the department answers.
Thank you for that question, Delegate. And we understand and we know the frustration that people are having signing up. We did look into doing a centralized system in the state of Maryland, and it just simply wasn't feasible. It's not appropriate for Maryland. I know that everyone has likes to compare us to West Virginia and say, well, West Virginia did it, why can't we? And there are a lot of back-end IT things that I'm not even going to try to explain because I don't understand them myself. But what I do know is that West Virginia has a single healthcare system. And so to coordinate across one system was fairly easy. In Maryland, we have 8 large healthcare systems that each use different electronic medical record databases. And to do the coordination on the IT side of it, we would have had to completely rebuild the system. And we simply didn't have the time to do that. They each use different, some of them use, I think there's PrepMod, there's Epic, there's several different sources. And so, the department did look into it and it was not feasible. We would have had to rebuild the entire IT system.
And if I could add to that, just Delegate Resnick, is that to date, we have only been receiving information about available vaccine from week to week from our federal partners. And providers are only opening up appointments when they're actual appointments, when there's vaccine to back them up. And so we also don't want to have appointments set when there may or may not be vaccine available. Now the federal government is being able to provide us with a little bit greater view down the road without, again, not week to week, but 2 to 3 weeks down the road. So that will give us better ability, not only at the state level, but also at the local level with all the different providers, a little bit greater visibility of what they might expect, not just next week, but 2-3 weeks from now for appointments.
Thank you, Delegate Resnick. Delegate Love.
Thank you, Mr. Chair. I believe you've answered my question, but I just want to clarify. When you talk about per 1,000 residents, it sounds like that's total population and not of the population that's eligible for the vaccines, 1A, 1B, 1C, because as Delegate Kelly alluded to, we have a very high population of seniors. So when you talk about we're getting a certain allotment per 1,000 residents, that's just all residents, correct?
Yes.
Okay, thank you.
Thank you, Delegate Love. Delegate Charkoudian.
Thank you, Mr. Chair, and thank you for being here. I want to ask specifically about childcare providers, and I think my question is sort of interrelated with a broader concern that's been raised about the primary strategy, which seems to be endorsed by the acting secretary, is try to get on as many lists as you possibly can. And I think that's problematic because that particular design, of course, takes our most vulnerable frontline workers, some of whom are eligible now, and makes them less likely, if they're working long hours, if they're working all day, if sites are opening up at 8 o'clock in the morning or whenever they are, and these folks have their hands full with diapers and babies and that they're caring for, they're sort of at even more of a disadvantage. I think it's a problem overall for everybody. To Delegate Resnick's point, it's a problem specifically for frontline workers. And then I just want to highlight the childcare piece of it, where we've seem to be doing a better job of finding ways to get teachers vaccinated, but I'm not clear on where there's a specific strategy that ensures that childcare workers are in there. I know that Delegate Solomon's done some work on this as well, but I'm just wondering if you can speak to, I guess, that specific part of it.
So this is something where, we would rely on our local health departments to develop that strategy. To be able to provide some access to childcare providers, again, because of the limitations in vaccine. There may not be, only a clinic for childcare providers. We have been working, of course, with Montgomery County Health Department, as well as with Hopkins to provide doses for educators and staff, both in the public and non-public settings. And there are, I believe, doses available through Montgomery County as well for childcare providers. And so in addition, our site at Six Flags and as we stand up, additional sites are available to them. And we're looking at making sure that the hours are such that it's not just in the middle of the day, for example, but to try to get into evening hours or hours that might be more accessible to individuals who are working during the day.
Look, thank you for that. I think it's also the when you can sign up. It's when it's available, but also like when you have to be on a computer hitting refresh. like when slots open. I think that's the other thing that I'm not sure if that's in the mix of what's being considered when you just think about who realistically can hit refresh all day long, as opposed to, you know, if they're working.
Thank you for that.
Delegate Vice Chair Carr.
Can you hear me?
You're on mute, Al.
All right. Is this better?
There you go. Yep.
I guess did Dr. Gales join us?
Yes, I'm here, Delegate.
Okay, thank you. Good morning. So yeah, I guess I'm hearing from my constituents that the sign up system in Montgomery County has some basic IT challenges in that it doesn't check for duplicates. So you might have a single individual who is in the system multiple times instead of when you log in, you know, a second time or attempt to make a duplicate reservation. It says, hello, Al, we see you have a reservation in the system. Is this true? And if so, what is the county health department doing to correct that?
Thank you, Delegate Carr, for your question, and I apologize for being late. I'm doing double duty for the meeting that some of you all sit on regularly on Friday mornings. And I do know that there were some other questions that were asked that I will circle back and answer. But to your specific question, as it relates to registration for an actual appointment, the system that the county uses is the PrepMod system that the state oversees. So the only other separate thing that we control is we have a pre-registration site that we as the county oversee, but actual registration for appointments that people go through and use is the PrepMod system that is the state system that you all have been discussing so far.
And Delegate Carr, if I could chime in, we're happy to take that back. I have not heard that specific issue come up in terms of a single individual being able to register for multiple actual appointments. One of the issues that has been raised, and we've been again working with a number of our local health departments to identify any operational issues that they're experiencing as they're using this PrepMod system. But one of the things is that we have heard is the sharing of appointment making links. And so our IT team has been working with PrepMod, and starting today, that system should be able to send individual appointment links that are good just for that one person without then being able to share that link for others. And so we are making improvements to be able to improve the functionality and then assist with the operations at the local level.
Thank you. Is this an in-house IT team, or are these hired consultants working on a temporary contract?
This is a system that excuse me, that we've actually been working with for a number of years outside of COVID, called Maryland Partnership for Prevention. They are a Maryland company, and they expanded and enhanced the system to be able to accommodate COVID vaccine as well.
Okay, Delegate Solomon.
Thank you, Mr. Chair. A lot of my questions have been asked already. I would just associate my comments with certainly Delegate Resnick's. I posted, what my constituents wanted to hear on Facebook this morning or yesterday. And the number one issue was a unified system. WBUR had a story about a software engineer in Massachusetts that designed a system that at least allowed the appointments to be aggregated. So I would strongly encourage you to figure out some way to streamline it. My question is a quick one. I know in the letter that we wrote, we asked any update on getting a mass vaccination site for Montgomery County, since we're the most populous jurisdiction in the state?
So we're happy to discuss that with the county. We continue to make sure that, that it's really about doses right now as well, to make sure that, if we open up additional sites, that there's some geographic spread, but also looking at how we can ensure that we can have enough vaccines for additional sites.
So then maybe this is a follow-up that I should have asked to begin with. What was the decision? How was the decision reached to place the other vaccination sites, again, when Montgomery County has the largest population by far in the state, and we were left out of the original batch.
Of vaccine. So as I said,
Of the vaccinations.
In Six Flags, again, the infrastructure was already there because the tents, the setup, you know, I don't know if you've actually been to the site, but we had set that up back in the summer for testing. And so the infrastructure and much of the staff was already available. And so that was one of the reasons why we were able to pivot and quickly put that site together.
And what about the other 5? How come Montgomery County couldn't have stood something up that quickly? That seems a little bit, and I see by Dr. Gale's face, I mean, it seems to me like if the commitment had been made to Montgomery County, again, 1.1 million people in the state, a sixth of the entire state population, if there had been a commitment to the county, we could have easily had a site set up. That seems crazy to me, but I appreciate your comment.
Okay, first of all, I know people are going to have to start dropping off for the caucus, but we're going to continue to go through the questions for people who can stay for a few more minutes. Let me just add, Dr. Chan, I appreciate your answer. It's very different than the answer the acting secretary gave, where he basically told the Senate vaccine work group, no way, no how to a mass vac site in Montgomery County because they can go to Six Flags, which I think is an absurd answer. If a lot of people from Montgomery County are going to Six Flags, that just reinforces the need for a mass vaccination site in Montgomery County. So I hope you'll continue to consider that. Thank you, Delegate Wilkins.
Thank you, Mr. Chair. I wanted to follow up to make sure I understand in terms of the number of vaccines that Montgomery County is getting. When you talked in the presentation regarding, you know, sort of the rate and number of vaccines that we are receiving, are we getting vaccines that are proportionate to the amount of the population that is eligible? Is that how we are receiving our vaccines in terms of the large number of people in Montgomery County that are actually eligible to receive it?
No, as I stated when Delegate Love asked this question, it's per 1,000 people. We did not look at who was eligible within the groups.
Why is that, given that the way that this is being rolled out is based on the only people who can get it are the people who are vaccinated? So in terms of handing out the doses, it seems like it would make more sense to give them out based on the number of people that are actually eligible, because of that, because of the way that you're rolling it out, we are just really struggling in terms of how many people are eligible in our county versus the number of vaccines that you're giving us. So I'm trying to just understand the thinking and if this is something that can be done differently.
To be honest, I don't have an answer to that. I'm not sure. I would have to go back to the planning team and ask them what the thought process was behind that. So I'll have to follow up with you.
Well, yeah, and
Okay.
I would
Well,
add
lives
that,
are. Go ahead.
I'm sorry, if you want to continue.
Oh no, go ahead. Thank you so much.
So, you know, when we get allocated vaccines to Maryland, it is for, you know, based on population as well. And when you look at the eligible population, it includes healthcare workers, it includes, you know, of course, the elderly, it includes teachers now and other. And so people can get vaccinated either where they live or where they work. And so people who are living in Montgomery County but work elsewhere may be getting their vaccinations. For example, if they work in Howard County, they may be getting it there. And so this is the way that we're currently approaching allocation of vaccine. There are other ways that others have also suggested in terms of impact of COVID and others, and trying to balance all of those various factors is what we're trying to do. But you know, we'll definitely take that into consideration going forward. But, you know, I think that for us, we're trying to balance population at the moment, and then beginning to focus our efforts into some of that, you know, the available vaccine into the most vulnerable areas and populations as we can.
Okay, well, last thing, I just want to state that it doesn't really seem like there is a scientific or strong reason behind how you're allocating it, and lives are hanging the balance, and we are not getting enough vaccines in Montgomery County for the people who are eligible. So if you all are able to review that and get back to us, that would be very helpful. Thank you.
There are 3 more questions. I suggest try to run through them quickly just because we all have to go. Delegate Chi, then Delegate Kaiser, then Delegate Lopez. Delegate Chi.
Thank you very much. I felt like that response to our delegation's earlier question about why not having a central registration system was really inadequate. We've had 2 months in learning the lessons and the mistakes, including oversupply to hospitals and all that seem like innocent mistakes. But no matter how many doses of vaccines we get, let's say we triple the amount you give us. If you have a crazy system that allows so many players to have their own registration system and you force people to hedge their bets across several lines, you're not going to fix the problem. Let's not talk about vaccines. Let's talk about the people. And the system has to work for the people. Maryland prides ourselves in being the most technologically advanced. Why can't we start exploring? And if short of that, can we at least at the same time empower the counties to coordinate across all of the pharmacies and clinics? I just don't accept the answer that this is not possible if we really want to do it. Thank you.
Dr. Chan, would you like to respond to that?
Thank you for that comment. And, we will take that back. I think that, again, if we're looking at providers, our ultimate goal is to get vaccine out to, every pharmacy, every primary care provider, and every location in the state. And so if we try to centralize all of that into a single appointment system, it really is trying to pull together electronic health records and systems from across the state and across different hospitals and local health department systems. But I understand, and what we would suggest is that individuals, we are getting vaccines to the existing vaccination sites. And so there just isn't enough even to go around to those who do have vaccine now. And so there is a wait for vaccine, and whether it's local health or hospitals or federally qualified health centers or pharmacies, they're trying to get it out as quickly as they can get it. And so if people register for a single system and there's a wait list, vaccine is coming. It is just going to take a little bit of time until we get the volume of vaccine available so that individuals can get it at a time that, that is, in a timely manner.
Okay, Delegate Kaiser.
Thank you, Mr. Chair. My question dovetails on so many others' questions about the number of vaccines that Montgomery County has received and the exact data of that 11.9 out of 1,000. But seemingly we were getting fewer from the state based on data that we all saw. And yet we were vaccinating a greater proportion than others. And yet because we were getting fewer, the governor was attacking Montgomery County for saying that we weren't vaccinating enough people when we were getting fewer. So I would just like to understand why we were getting even fewer than that proportionate average.
We're happy to share the slides with you that that my colleague Heather Scheck shared a little bit ago, and that shows that we are providing Montgomery County as a whole a vaccine proportionate to the population. And that's really the approach that we're taking is, looking at, all providers within the county and providing a proportionate share among all the different providers.
Okay, Delegate Lopez, last question.
Thank you, Mr. Chair. Everything has pretty much been said that I would want to associate myself, so I'll give a me too to the comments of my colleagues. But one thing that we haven't really talked about is the outreach. And just to be very quick, can you tell me just in one sentence, when a constituent reaches out to my office looking for a vaccine, what am I supposed to tell them? Just one sentence.
I think register for a site that whether it's local health or at a pharmacy, and the vaccine will be coming. It is taking time because we are still getting limited numbers of doses every week.
Okay, Thank you. Dr. Gales, is there anything you wanted to say at the end here? I appreciate you being on. I'm mostly being in listening mode today.
No worries. I again apologize for being late. I just wanted to quickly point out a couple things. I know there was a question asked earlier about childcare providers. We as the county have been providing an allotment of 100 doses, working with our children, youth, and families colleagues to identify folks who are eligible to come in and get that. We continue that process. And I wanted to point out is that part of the reason why we have concerns about the allotment of doses that health departments are receiving being cut is that each week we've had additional expectations to cover folks, childcare workers, independent living facilities that were not covered by the federal partnership, which, by the way, we have started to go in and do vaccination. We did one site earlier this week. We have 2 set up today. And so just want to make sure that you all understand that we are working to address those needs with the doses that we're receiving. And the last thing I would say is we are, and we can talk in more detail about this offline, we are diversifying the points of contact that folks can have access to. In addition to the large sites that we have at Richard Montgomery and Quince Orchard right now, we will be adding a 3rd larger site, but also working with our community partners to do some on-site vaccination in areas that are high volume for 75 and up to get increased penetration within that population within the next week. So we're standing those up as we get those scheduled. We're working with our minority health initiatives and programs to do so, our municipal leaders, as well as other community clinical providers as well, to be able to meet the diverse needs of the community and meet folks where they are.
Dr. Gales, thank you. Chair Zucker, anything to close us out?
No, thank you for appreciate the delegation.
Great. Look, thank you to both the state and the county health folks for being with us and responding to our questions. Obviously, there are what I see as 3 different problems. One is communication with the public, with us, with our count between the county and the state. It's really problematic. 2 is obviously the supply. That's the one you guys have the least control over. I appreciate that. And then 3 is just sort of the efficiency of delivery based on the supply we have. And those are obviously overlapping problems, but a lot of what you heard here falls into those 3 buckets. So we just ask that you continue working with us, and we'll probably look for a response to that letter we sent earlier this week, which touched on a lot of issues that we hit on today, and maybe have some follow-up after that. But really appreciate you joining us and engaging in the discussion as we try to help our constituents get shots in the arms, which is what the goal is, I think, for everybody. So thanks for joining us, and we have to adjourn because we are all 10 minutes late for another meeting. So thanks again.